Okay, so the first thing that I'm going to do is ensure patient privacy. I'm going to close the curtains here, wash my hands. I'm going to put on gloves. I'm going to raise the bed to an appropriate height that's good for my back. Obviously we're improvising, so I'm going to kneel here. I'm going to check my patient's ID band and confirm that it is correct. Ma'am, can you tell me your name and date of birth?
Nicole O'Connell, 12/18/88.
All right. Do you have any allergies?
No.
Okay, and what brings you into the hospital?
I have a pain on my left side.
How long has that been going on?
6 hours.
About 6 hours? What were you doing when it started up?
I was eating dinner.
Okay, and if you were to describe the pain to me using one word, what would you use?
Dull.
Like a dull pain? All right, and on a scale of 0 to 10, with 10 being the worst pain that you've ever felt, what would you rate this?
A 6.
About a 6? Okay. Does the pain go anywhere else other than where you're holding?
No.
No? And has anything like this ever happened to you before?
No.
Okay. Do you have any medical problems?
No.
No? Okay. So I'm going to perform a head-to-toe assessment, and then I'm going to collect that data and document it in your chart.
Okay.
All right? So I have my gloves on. I'm going to start with your head here. I'm going to inspect to make sure that there's no lumps, bumps, infestations, any deformity or asymmetry. I'm going to palpate here to ensure that there's, once again, no lumps or anything like that. I'm going to assess ears here for any type of drainage, CSF, redness, asymmetry. I don't see anything there, so no problem. I'm going to assess nostrils for any type of drainage as well. It appears that our septum is midline. I'm going to assess your pupils to see if they're reactive. All right, go ahead and look forward. Good. Excellent. All right, pupils are pearl with accommodation at about 4 millimeters. Okay, Miss O'Connell, would you do me a favor and follow the pen as it goes closer to your face? Good. Side to side. And then up and down. Excellent. Okay. So we're good there. I'm going to whisper a couple of words here and I want you to repeat them if you can hear me, all right?
Okay.
Red.
Red. Blue.
Good. All right. So from here, I'm going to take this alcohol pad and I'm going to put it up against your cheek here. Let me know if you feel that.
Yes.
How about here?
Yes.
All right. I'm going to open this up. Tell me what you smell.
Alcohol.
Okay. Leave that there. Go ahead and raise your eyebrows and clench your teeth. Good. I'm going to push down slightly here. I want you to shrug your shoulders. Excellent. Okay. So from here, I'm going to go down to the neck. I'm going to assess for any type of JVD. We're in the right position to assess that here, so we're negative. Her trachea is midline. It doesn't appear that there's any subcutaneous emphysema. I am now going to auscultate your carotid arteries to ensure that there's no bruit. All right, carotid pulses are equal, bilateral, and present. Now I'm going to assess your carotid pulse and your radial pulse simultaneously. They're intact and symmetrical at a +2. I'm going to do that over here on the other side. Excellent. Okay. I'm going to check here for pre-auricular lymph nodes. Everything seems intact. Post-auricular, mandibular, and I don't feel any type of inflammation in those lymph nodes. Okay, so we'll be moving on to an interior chest assessment here. I'm going to bury your chest and listen to your heart sounds.
Okay.
All right, so we're going to be starting over on the right side here, assessing aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to go back up to Erb's point here, and I'm going to assess an apical pulse for an entire minute. For the sake of this drill, we want them. Okay. Let's assess your breath sounds. So I'm going to ask you to take a series of deep breaths for me, okay?
Okay.
I want you to make sure that if it hurts, you let me know. Okay, deep breath. Excellent. All right, Mrs. O'Connell, I'm going to have you sit up and check your breath sounds from the back. How do you feel sitting up?
Good.
So I'm going to inspect the area here, make sure that there's no deformity, step off, no type of decubitus ulcer formation or anything like that. Ask if there's any pain upon palpation of the spine. Any pain here, ma'am?
No.
Okay. All right, I'm going to be having you take another series of deep breaths. Go ahead. And one more. Excellent. Okay, and while I have you here, I'm going to assess the costovertebral angle for any type of tenderness, which is going to be right here. Do you feel any pain?
No.
Let's try that one more time.
No.
All right, I'm going to have you lay back down. Okay, at this point, I'm going to assess the abdomen, so I'm going to bear that area to inspect it. I'm going to look for any signs of ascites, rigidity, any type of distension, which it appears that we're clear on that. So next I'm going to be auscultating, starting at the right lower quadrant. Once I hear a vowel sound, I'll move on in a clockwise fashion. Okay, we have vowel sounds in all four quadrants. Now I'm going to palpate. So I'm going to push in. Let me know if you feel any type of pain, okay? Specifically right here, I'm going to push in. Do you have any pain there?
No.
And when I let go?
No.
Good. How about here?
No.
Here?
Yes.
Okay, so we do have some tenderness and guarding off to that left upper quadrant, which is our area in question. And one more. Anything there?
No.
No? Great. Okay, so from here, I'm going to percuss the abdomen. Okay. Cover that up. How have your bowel movements been?
Normal.
Normal? Okay. Have you been urinating frequently?
Not any more than usual.
Not any more than usual. How's your water intake been?
Pretty good. I keep hydrated.
Okay. No blood or tarry stools?
No.
Excellent. Okay, so from here I'm going to move down to the pelvis. I'm going to ensure that there's no tenderness, instability, or crepitus. It appears that there isn't. Was there no pain there?
No pain.
Okay, I'm going to assess the perineal area, ensure that there's no skin breakdown, no excess urine or moisture in the area, and if there's a Foley catheter, I'm going to assure that it's intact, and I'm going to report the color and clarity of that urine. So from here, I'm going to do a lower assessment or a lower extremity assessment on you. I'm going to inspect the area, make sure that there's no redness. I'm going to assess for edema. We're negative for edema, looking for any signs of JVD, coolness, and I'm going to assess range of motion here. Go ahead and lift up. Any pain?
No.
Excellent. I'm going to come down on this side. Any pain there?
No.
Excellent. Okay, so from here I'm going to assess dorsal pedal pulses bilaterally. It appears they're present, bounding, or present +2 bilateral. Okay. So we're done there. I'm going to go back up to your arms. In the event that I was able to sit you up, I would assess your tendon reflexes in your feet. But I'm going to look at your upper extremities here, inspect them. Doesn't look like there's any gross deformity. Do we have good range of motion here? Yes. Any pain upon movement?
No.
Good. Check radial pulses. We'll do this for 30 seconds for a set of vital signs. They are equal bilateral +2. Excellent. So I'm going to have you stand up for me and we'll have you take a couple of steps. Right here in this corner. All right, go ahead and walk toward me, 3 steps. Excellent, go ahead and walk back. All right, turn around and go ahead and lay back down for me. All right, so that finishes our assessment. I'm going to bring the bed back up. I'm going to put the rail up, take my gloves off, wash my hands, and I'm going to ask the patient if there's anything that she needs on the way out.
No.
You don't need anything?
I'm good, thank you.
Okay, so I'm going to put the bedside table here, and I got your call light. I'm going to go get you some pain medication for that left upper quadrant pain. All right.
Thank you.
And that's it.